GERD may result from a weak or damaged valve between the stomach and the esophagus. Stomach acid that washes up into the esophagus can cause dangerous tissue damage. GERD, gastroesophageal reflux. Reflux, flow back or upwards. Gastro, related to stomach. Hiatus, opening or gap. Les, the lower esophageal sphincter. Acid reflux, when some of the acid contents in stomach rise or flows backwards, upside, into the esophagus and throat, it is called acid reflux. Lower esophageal sphincter helps the food to pass into the stomach and it does not allow the food to come back into esophagus. When this ring-shaped sphincter fails to stop the stomach content back into the esophagus, it is called acid reflux. Acid reflux normally takes place if there is indigestion, heartburn, etc., but when this happens often over time, it may be acute acid reflux or GERD. GERD stands for gastroesophageal reflux disease. Gastroesophageal reflux disease, GERD, is a digestive disorder that occurs when acidic stomach juices, food, and fluids back up from the stomach into the esophagus. GERD affects people of all ages, from infants to older adults. Symptoms: backwash, regurgitation, food, acid, solid liquids from stomach to throat is called backwash or regurgitation. Heartburn, acid indigestion, burning sensation in chest is called heartburn. It normally worsens after eating, while bending, or while lying down. Chest pain, it feels like a burning chest pain. People feel pain in esophagus that activates the same nerve as heart-related pain does. Some people witnessed that they feel like food or acid or sour taste coming back to mouth. Nausea, backwash or acid may feel loss of appetite, and with distaste for food there may be an urge to vomit. There may be also other symptoms like difficulty or pain when swallowing, dysphagia, chronic cough, asthma, complications in mouth and throat, bad breath, sudden excess of saliva, loss of appetite. Causes: acid reflux is quite common and normally happens after eating heavy meals, lying down after eating food, etc. But frequent acid reflux causes GERD, and frequent acid reflux has many causes. Overweight or obesity can put pressure on the abdomen, which can lead lower esophageal sphincter and may promote the reflux stomach acid. Pregnancy is a common cause of temporary acid reflux. The hormonal changes and increased pressure on the abdomen during pregnancy can contribute to GERD symptoms. Smoking, those who smoke and those with exposure to second-hand smoke. Smoking can weaken the les and contribute to the development of GERD. It also reduces saliva production, which normally helps neutralize stomach acid. Smoking also slows down digestion and causes stomach to produce more acid. Hiatal hernia. A hiatal hernia happens when part of the stomach pushes up through the diaphragm into the chest cavity. This can contribute to GERD by weakening the les and allowing acid to flow into the esophagus. Connective tissue diseases may affect esophagus muscles by diseases like scleroderma. Weak lower esophageal sphincter. When les becomes weak, stomach acid can flow back into the esophagus. Certain foods and drinks, certain foods and beverages can relax the les or stimulate acid production, worsening GERD symptoms. Common triggers include citrus fruits, tomatoes, chocolate, caffeine, alcohol, and spicy or fatty foods. Gastroparesis. When the stomach takes longer than usual to empty its contents, there is an increased risk of acid reflux. Certain medications, some medications can relax the les or irritate the esophagus, leading to GERD symptoms. Examples include calcium channel blockers, nitrates, antihistamines, and some asthma medications. Diagnosis: there are several tests to diagnose GERD. Esophageal pH and impedance monitoring. This test measures the amount of acid in the esophagus during eating or sleeping. Upper GI endoscope. This is a thin tube with a camera, endoscope, attached that passes through mouth so to inspect the esophagus. A small sample of tissue for biopsy may also be taken to test complications such as Barrett esophagus, etc. Upper GI series. It is a type of X-ray which is taken after chalky liquid called barium is swallowed. It allows seeing a silhouette of esophagus and stomach and upper part of small intestine, duodenum. It can provide limited information about reflux, but it can help people having trouble swallowing and can also help to rule out peptic ulcers. Esophageal manometry. This test measures muscle contractions in the esophagus during swallowing. It measures the strength of the sphincter. It can also confirm if lower esophageal sphincter, les, and other muscles are working normally or not. Brevo wireless esophageal pH monitoring test. A small capsule is attached to the esophagus that measures the acidity continuously for approximately 48 hours. It helps to know when stomach acid backs up into the esophagus. To be continued. Thank you for watching my video. For more videos, kindly like, share and